अरे ये बच्चा दूध ही नहीं पीता, बस हर वक्त रोता रहता है.
ஐயோ, இவங்களுக்கு குழந்தைக்கு கொடுக்கறதுக்கு தாய்ப்பாலே வரலையே.
આ સ્ત્રીઓને આટલા બધા બાળકો છે, તેમને ખવડાવવા માટે તેમની પાસે સમય અને શક્તિ કેવી રીતે રહેશે?
Aren't they popular voices across India? According to the NFHS 5 data, 36% of children in India are stunted, 32% are underweight, and 21% are wasted. According to the same data, 64% of women in India exclusively breastfeed their babies. Why do we have acute malnutrition despite high levels of breastfeeding?
Thanks to the modern way of living, there are distractions and hence breastfeeding, even if exclusive, is not effective. We can overcome this problem by teaching mothers how to breastfeed effectively and confidently. At IIT Bombay, after extensive research, we have come up with health spoken tutorials under the Spoken Tutorial project. Our goal is to reduce the malnutrition from the time a baby is born till it becomes 2 years old.
Spoken tutorials are 10-minute long audio-video tutorials created for self-learning. In the education sector, 7 million students have been trained on various IT topics using spoken tutorials. Using the same methodology, health spoken tutorials have been created to impart training to medical officers, nursing staff, medical college students, and government community workers like ASHA and Anganwadi workers.
Education technology has the power to take correct information to the right audience at the right time. All of those who undergo our training will have access to over 100 tutorials on effective breastfeeding and complementary feeding. Our tutorials are created by a team of pediatricians, gynecologists, nutrition scientists, graphic designers, and many more. These tutorials are made in 14 constitutional languages as well as a few tribal languages like Korku, Santali, Bhili, and Pawara.
Since 2018, our team has trained around 10,000 health workers across the country on breastfeeding and complementary feeding using health spoken tutorials.
आईआईटी बॉम्बे के साथ जिला परिषद नासिक ने एक उपक्रम शुरू किया है जिसमें हम माल न्यूट्रिशन पे काम कर रहे हैं और आईआईटी बॉम्बे ने बहुत अच्छे हेल्थ स्पोकन ट्यूटोरियल्स बनाए हैं. इनके थ्रू हमने अपने जो हेल्थ वर्कर्स हैं उनमें से 300 ऐसे हेल्थ वर्कर्स चुने जो बहुत मोटिवेटेड थे. उनकी हमने ट्रेनिंग की और उनके थ्रू अभी हमने मास्टर ट्रेनर्स क्रिएट किए हैं और अब इनके थ्रू हम ये जो ट्रेनिंग है ये हर एक जने की अपने जिले में करा रहे हैं.
As an administrator, HST team not only gave me a perfectly mechanically engineered technique of how to breast hold a baby for effective milk transfer from the mother to the child, but also a complementary feeding technique which was protein oriented. We not only trained our health workforce but also the self-help groups and the sarpanches in the relative techniques, so much so that our numbers for Sam and Ma'am could be reduced by 1,500 and 3,000 respectively over a period of 1.5 years.
It is gratifying to see the use of education technology to combat malnutrition. Every baby counts.
If you are a hospital, government agency, or an NGO and would like to implement our program, write to us at health@spoken-tutorial.org. Together, let's build a healthier India.